Hello, everyone. Welcome to our live stream panel, Abortion Access in the Age of COVID-19. My name is Sarah Hogg. I am a campaign manager here at Daily Kos, where I focus on things like abortion rights and access. My pronouns are they, them, and she, her. I've been working in the abortion access and funding movements for a little over 8 years now, and I'm so excited to be here today with my co-host Tina and our incredible, wonderful panel.
Hi, I'm Tina Vasquez, she and hers, and I am the gender justice reporter at PRISM.
Thank you, Tina. So we want to welcome everyone for a moment, and really before we begin, we want to thank you for being here and for holding space for the panel, especially given the recent rash of murders of Black people at the hands of police and white supremacist vigilantes. As we spend the next hour together, we also want to honor and acknowledge George Floyd, Tony McDade, Breonna Taylor, Ahmaud Arbery, and numerous other Black people who have been lost to state-sanctioned violence. We want to unequivocally declare that Black lives matter. Tina and I are thrilled to co-host this panel, where we'll be talking about abortion access in the age of COVID-19. From abortion pill restrictions to anti-abortion politicians who are trying to deem this procedure as a non-essential medical service, many patients and providers are fighting an onslaught of barriers to receiving and providing care. As we'll hear from our panel, these roadblocks really exacerbate a number of existing inequities in abortion access, and they impact the most marginalized, primarily low-income people, people of color, and people living in rural communities. Today, Tina and I will be talking with our panel of experts about how exactly COVID-19 is changing the landscape of abortion rights and access, how we can look to leadership in the US South, where many are essentially already living in a post-Roe world, and how we can draw from the strength of patients and providers as we continue to fight for access. Now, I'm going to turn it over to the rest of our fantastic panel to introduce themselves. So Carol, go ahead as we bring you into the room.
Hi, I'm very happy to be here. Thank you, Daily Kos. Thank you, PRISM. I am Carol Jaffe, she, hers. I am a professor at the University of California, San Francisco, and I study abortion provision.
Next, we want to introduce David.
Hi, thanks so much for having me, Daily Kos and PRISM. I'm David Cohen. I'm a law professor at Drexel University School of Law, he, him pronouns. I am co-author with Carol of the book Obstacle Course, The Everyday Struggle to Get an Abortion in America. And I've been studying abortion for a long time and representing abortion clinics in litigation for decades now, and happy to talk about abortion access today.
Great. Welcome, David. Next, we would love to introduce Dr. Moyetti.
Hi, thank you so much for having me today. Honored to be with you. I'm Ghazal Moyetti, she, her, hers. I'm an OBGYN and abortion provider here in Texas.
Thank you so much. And finally, we'd love to introduce Camyon.
Hi, I'm so excited to be here. Thank you so much. My name is Camyon Connor. I use she, her pronouns, and I'm the executive director of the Texas Equal Access Fund, located in the Dallas-Fort Worth area. We help people access abortion care via financial assistance when they can't afford it.
Fantastic. Welcome, everyone. Again, we are so thrilled to have you. And so let's jump right in. First, I want to ask Carol and David. As part of the research for your book, you did interviews across the US and in Puerto Rico about the insurmountable barriers that people face when trying to access abortion care. What do you want people to know about what you learned, and what were you surprised to learn in the process of researching your book?
Thanks for the question, Sarah. So The book that we wrote, and it just came out a couple months ago, our main goal was to explain how even though abortion is a constitutional right and Roe v. Wade is still the law of the land, that this constitutional right is very difficult for many people in this country to access because there are, we call it obstacle course for a reason. There are obstacles that state legislatures throw up in people's faces that makes it really difficult for them to access. And as you said in your introduction, these obstacles have a disproportionate effect on people of color, on low-income people, and people who live far from urban centers, because every step along the way, when people find out that they're pregnant to the moment that they get the abortion, every step between those two, there's an obstacle that states put in their path. So they make it difficult for people to make decisions. They make it so that it's hard to find a clinic, hard to get into a clinic. Then you have to wait from when you get to the clinic to get a procedure. You can't use your insurance to pay for abortions. If you're on Medicaid, it's prohibited. And then the procedure is regulated in a way that no other procedure is regulated. So it's not doctors and medical people making the decision on how to have an abortion. It's the state legislature. All of these obstacles make it incredibly difficult, but it's not entirely a negative story, and Carol's going to pick up the rest.
Right. Yeah, there's a more positive spin to this. Sarah, you asked what surprised us, and I would say two things surprised me, even though I'd been studying this world for a very long time. The first thing that surprised me was just how hard it was for many people to just get to the abortion that they needed. I mean, we knew already that paying for abortion was a problem for many. As David said, that the majority of abortion patients are poor, some of them very poor. 50% live below the poverty line. Another 25% are classified as working poor. So we knew it was going to be hard to pay. I didn't realize just how hard to get there. And this is in part because of not just the restrictions, but just how distant many clinics are. But the good news is, relatively speaking, the good news is that people make extraordinary efforts, and providers make extraordinary efforts, and allies make extraordinary efforts. In a little while, you'll be hearing from Camion, and you'll be hearing how absolutely important the role of abortion funds are. But what really struck me doing these interviews was just hearing about this, what we can call an unheralded army of volunteers across this country who go to extraordinary lengths to help people get to abortions. We heard a story, I mean, this is not typical, but it's on the continuum, a woman in her late 60s who was a local volunteer. She thought she was taking a patient for an hour drive to a clinic in the South. The clinic couldn't see this particular patient because she had health issues that made it not appropriate for that clinic. They then drove to Washington, D.C., where they thought, and this is from the South, they drove to D.C., they thought maybe she can get an abortion there. Turns out even that clinic couldn't help her. They then drove to New York City. She finally got her abortion. This was a 3-day odyssey, and then they drove home in a blinding thunderstorm back home 12 hours. So, I mean, this is what is going on to some degree or another all over this country. And it's extraordinarily inspirational to see the decency of so many people. However, as inspiring as this is, and I'll just finish with this, after hearing these stories, I have to question, is this an appropriate way to do healthcare? I mean, there'll always be a place for volunteers. in the abortion world. There'll always be a necessity for the abortion funds, but we can't depend, to borrow a line from the playwright Tennessee Williams, we can't always depend on the, quote, kindness of strangers. What if this particular patient did not luck into having this retired woman who had the stamina to drive for 3 days through rainstorms to get her to 2 different states? Anyway, all of which is to say, people who need abortions are, for the most part, we can say, still getting them, but at extraordinary difficulty. And as we'll be talking about later as this event progresses, obviously the COVID crisis has made many of these events much more difficult.
Great. Thank you so much, Carol, and thank you, David. That was a fantastic way to set the stage for the rest of our time together. So really, before we jump into the rest of the questions, I would love to chat with Tina a little bit about the work that we are doing here at Daily Kos and at our nonprofit media partner PRISM, really around how to access abortion while we're in a pandemic. And so I'll start. So like I mentioned at the beginning, I'm a campaign manager here at Daily Kos, which means that I write a lot of actions. I write a lot of petitions and letter campaigns, really urging people to take action in their own communities to make change. And one thing that we have done is we are urging the FDA to lift restrictions on the abortion pill so that people are able to have medication abortions at home without these massive burdens of having to visit an abortion provider in the office once or multiple times. As we know, medication abortion is exceedingly safe, and it is very safe to take those pills at home. So we are very strongly urging the FDA to lift these arbitrary restrictions. We are also calling on a number of officials across the country to deem abortion an essential medical procedure. This has been a major point of debate in the last few months. You have most likely seen a number of governors or attorneys general trying to classify abortion as a non-essential medical service. This is simply not okay. You cannot wait to have an abortion. It is a time-sensitive procedure. And so we are calling on elected officials, primarily governors and attorneys general, to take action to protect abortion in their state, especially during the pandemic. And finally, I also want to mention that in addition to our national work, we are also working with our state partners very closely. For example, we are working with folks in North Carolina to try to redirect money in the North Carolina state budget away from fake health centers, which some people may also know as crisis pregnancy centers. These fake clinics very often, and always really, I should say, lie to people. They trick people who think that these clinics are actually providing abortion care, when in fact they are often faith-based, anti-abortion, and sometimes state-funded clinics that try to persuade people out of seeking abortion care. And so we are working with our partners on the ground in North Carolina to ask state lawmakers in North Carolina to redirect over $2.5 million that was allocated in the 2019-20 state budget away from these fake clinics and to real public health initiatives that will help in the future when things like COVID-19 crop up again. And so I will now turn it over to Tina to hear about some of the fantastic work she's doing over at PRISM.
Thank you. So I joined PRISM as the gender justice reporter in February. The first piece that I wrote for the website was about self-managed abortion. in light of the June Medical Services case, which we will talk about shortly. Given that the case emerged in Louisiana, I wanted to report on the conditions that folks would be navigating in the state if they chose to self-manage. So the important context was it's a state that's hostile to abortion access. It's a state that historically has had the highest incarceration rate in the nation. Under the Trump administration, it's become ground zero for immigrant detention. And historically, prosecutors in the state criminally prosecute people for their pregnancy outcomes. So I wanted to kind of set the groundwork for people who were maybe considering self-managing in the state so that they understood what they were navigating. I'm also really interested, so I joined PRISM from Political Research Associates, which investigates right-wing movements. So I think of opposition research now as part of my job at PRISM. And with Chloe Cooper, who's a brilliant researcher at PRA, I co-wrote a piece about sanctuaries for the unborn. So Chloe focuses on militia movements, and in investigating Second Amendment sanctuaries for the unborn kept coming up. And so we wrote a 2-part series unpacking this movement, part of the anti-abortion movement that's led by young white men who identify themselves as abolitionists. They see themselves as modeling themselves after slavery abolitionists. They want to abolish abortion. At a state level, they advocate for bills that would abolish abortion and treat abortion as murder. So people who access abortion care would receive the death penalty, according to these bills. But they also operate at like a hyper local level. So they go to county commissioner meetings, they go to city council meetings, they push for jurisdictions to become sanctuaries for the unborn, which create additional barriers to accessing care in local jurisdictions. And I think, the reporting I recently did that's most pertinent to this panel is that I wanted to write about how abortion care is essential health care, especially during a pandemic. And so I interviewed abortion providers like Dr. Moyetti, clinic directors, abortion funders nationwide about their commitment to continue providing abortion care through the pandemic, even though they're up against a lot of challenges, including lawmakers who are using COVID-19 as an excuse to limit access to care. Moving forward, some of the reporting I really want to delve into is looking into abortion funds in southern states and the role that they play, which is why I'm so excited that Kamyan is here. I feel like, for good reason, when we talk about abortion access under the Trump administration, it is a lot of gloom and doom, but there are also bright spots. I certainly see abortion funds as a bright spot. And so if you could talk to us about, like, for folks who have no context whatsoever, what is an abortion fund? Why is it important? What service is it providing to folks? And then tell us about the work that you're doing in Texas as the executive director of the T Fund.
Thank you so much for that, Tina. I love abortion funds. Abortion funds are radical and very fun. We are fierce advocates, and I would say abortion funds provide a couple of different types of services. One of those being providing financial assistance grants to people who need access of abortion. You might wonder why people might need help paying for an abortion, not just because they might be low income, but also because, at least in the state of Texas, there's no public coverage or private coverage of abortion care with insurance. And so people have to pay out of pocket. And in the place where I live, the average starting cost of an abortion is $450, and it goes up from there. And so I know a lot of low-income folks on fixed incomes where that's like literally what their rent is. And so that's someone's livelihood and the money that they need. Abortion funds also do another type of service, which is called practical support. That's what we call it. And that basically means everything else. So all of us know that in all 50 states, abortion is legal, and people have the right to have abortions in those states. But what good is a right if you don't have access? So abortion funds literally are a direct link between patients and clinics and helping them ensure that they get abortion care that they need by giving them access. In Texas, there are a lot of rural areas and our state is so huge. So traveling is like a huge barrier for a lot of people. And so there are abortion funds that provide rides to people via volunteers, giving them rides to clinics, or providing vouchers for them to get a Greyhound bus or a plane flight to an abortion clinic that they need to go to. They also will support with childcare. They'll support with lodging and food. They'll support with food as well. I want to uplift that during COVID, like the practical support funds, especially in Texas, got hit very hard because once the restrictions were put in place, that meant everyone was trying to figure out how to get out of our state to access care. But without being able to use a Greyhound because they shut those down because of the close quarters, not being able to really to fly. And then even if they drove themselves or got a ride from someone to another state, at the beginning, there were a lot of hotels that had limited amount of space, like they wouldn't let people stay. And so they didn't have somewhere to stay once they got there. And then on top of that, they couldn't go to restaurants to get food, and hotel rooms don't really allow you to cook your own food. So there was like a lot of complications that abortion funds really like came to the forefront and helped people ensure that they had access to care. I'd also say that like a lot of people were surprised and kept asking, oh, are you helping people get outside of the state to access care during COVID? And I would say yes, but that's something that abortion funds in Texas have always had to do because of the harsh restrictions on abortion in our state. People have often always had to go to other states for care. So abortion funds are at the forefront of a lot of social justice fights. We mostly, I'll speak for the T Fund in this, but we operate at the intersections of reproductive health, justice, and rights. And on the reproductive justice aspect, that's pretty much everything else. That's like the environment, that's you being able to access, that's the inclusion of trans and non-binary folks in the conversation of abortion. That's the conversation around the fact that with the onslaught of violence that we've seen recently against Black people in our country, talking about how Black mothers even being able to parent, but not being able to protect their children from violence is also a restriction of being able to thrive in our environments the way that we should. So I'll also speak to the fact that like T-Fund does a lot of stuff. My abortion fund, we serve 110 counties in the state of Texas. Most of those are rural. And we also provide some practical support in the way of client engagement. We provide some emotional support to folks. We have a post-abortion truth and healing support group for people that have had abortions. And we really invest in those folks to get them involved in the movement as well. We do clinic escorting because our clinics asked us to, because they needed support for their clients' safety coming in and out of the clinics. And we do a lot of advocacy work. We know that as abortion funds, we provide a service that's essential, but like Carol said, people accessing abortion care deserve better. They deserve more. They should have the access. There shouldn't be all of these barriers, so that we know that there has to be systemic change. And at our fund, we've hosted local advocacy days, statewide advocacy days, and also are continuing to file Rosie's Law, which would expand Medicaid coverage of abortion in the state of Texas. So those are just some of the things that abortion funds are doing all over the map, but mine as well.
Thank you so much, Camion. That was a fantastic overview of abortion funds. And we're going to continue on and we're going to keep talking about Texas because as Camion explained, Texas is really hostile to abortion rights and access. And this has been really devastating to watch over the years with various laws and restrictions like HB2. And so I want to ask you, Dr. Moyetti, because you provide abortion care in Texas. And providers like you and patients in need of care have really been put through the ringer, not only in the past few months, but for years and years and years. This really came to a head recently when the governor of Texas really tried to use the pandemic to restrict abortion access in the state. This is what Camion spoke to, and it really threw the state into a frenzy. And I would love to hear where things are right now in Texas. Can people who need an abortion actually access care? And also, I'd love if you could talk to us a bit about what kinds of hurdles folks have to jump through that actually have nothing to do with COVID-19.
Thank you so much for that question. And I think it's an important one. So I'll start by saying, just like what Camion mentioned, that abortion is still legal in every state in the United States, and that includes Texas. However, as we have known in Texas for quite a while, and I've been working in abortion care, rights, and advocacy in some form or fashion for the past 16 years in this state. The right to an abortion does not mean that people can access it. And that has always been true in Texas, despite COVID or not. So currently our clinics are open and our clinics are serving our communities as best as we can with skill and compassion like we always have. And we have always been really at the intersection of providing compassionate, highly skilled care and having to daily fight restrictive legislation from within our state. And so prior to this shutdown, the people that we serve and the communities that we serve have struggled to get access to their human right to an abortion. And so that struggle comes in many forms. It comes in our physician-only laws that mandate that only physicians can provide abortion care, when we know that there are many healthcare providers that are skilled and competent at providing abortion care, like nurse practitioners and midwives, and even cultural practitioners. So physician-only laws are one way that we have restricted access here in the state. Our 24-hour waiting period law, which was then further was restrictive enough, requiring a 24-hour consultation prior, but then recently in the past few years was changed to the 24-hour consultation had to be done in person with the same physician that provided the abortion. This meant that patients had to come to the clinic twice, and it also meant that physicians had to be there twice. And we know that in states like Texas, many physicians are traveling to provide that care. And so it meant that physicians had to travel longer, or that fewer physicians were able to come. On top of that, we have mandatory ultrasound law. We have mandatory follow-ups for medical abortion. We have restrictions on telemedicine abortion. We have mandatory parental consent. We have laws that require specialty care centers, ambulatory surgical centers for abortions past a certain point. And we have laws that restrict the gestational age of abortion provision. So none of these laws serve to make abortion care safer, and in fact have been shown to not make abortion care safer because they restrict access. We know that abortion is time sensitive, it's urgent, and when someone needs or wants an abortion, they need to be able to access it quickly. So all of these restrictions existed before COVID. And, for us that have been providing this care on the ground here in Texas, as we started seeing in late February and early March, this pandemic start to take shape, many of us began speaking up that in fact we were concerned that restrictions were going to be placed further, and really what we needed to be doing was lifting every restriction on abortion, that all of these laws are medically unnecessary, and when we're talking about them in the setting of a pandemic are insurmountable. They are creating just insurmountable barriers to care.
Thank you for outlining what's happening in Texas. I think we know that abortion access differs pretty drastically depending on where in the country you are. I was talking about sanctuaries for the unborn earlier. I've been thinking a lot about how effective that movement has been. Ordinances have passed where I live in North Carolina, where y'all live in Texas, and they're fighting at a hyper local level, and they're effective because they're creating barriers for people who want to access abortion care. So I wonder if there's a lesson to learn in that and what a local fight looks like. So I want to ask all of you, what does a local fight look like? Either a statewide fight or more local than that, hyper-local county commissioner, city councils, as Antis are doing. How does that take shape for you?
I'll jump in first and just weigh in that I think part of the success of the opposition movement, the anti-choice movement, has been trying to claim the moral high ground. And I think it's important for us to center that our work as abortion providers, as abortion funders, is moral. It's just that abortion is a human right. And no matter what someone's opinion is about abortion personally, that we can all and almost all people agree that the decision to have a family, the decision to expand your family is very personal and really should be between a person, their healthcare providers, or their trusted community members, and that there shouldn't be intervention from the state in that. And so centering that we do moral work and that our work is human rights work is key to the local debate and the local struggle.
An example from California, and this is not to make my Texas colleagues feel bad. I mean, California, of course, is a very pro-choice state. One of the successes we've had in the last year was a group of feminist public policy advocates decided that each of the each of the California universities and four-year colleges should provide medication abortion in the college or university infirmary. And a very successful partnering took place between these advocates and researchers who I work with at UCSF who studied this, who are able to go to the state legislature and say, this is safe, this could be done. Of course, California is a very pro-choice state. You cannot get elected to statewide office the Democrats dominate the legislature. So the bill it wasn't all that easy, but the bill passed. And that's a successful example, I think, of researchers. And in Texas, you have a fantastic group at University of Texas who study the impact of all the horrible things that Dr. Moyadi just told us. Yes, I absolutely agree that statewide coalitions are incredibly important. But I also want to say that in the world we are already in and will more so be in, we have to prepare for a lot of interstate travel. That's already been going on, but that will become both more urgent because of COVID, and we will hear later what June v. Russo, the Supreme Court case might be. Anyway, all of which is to say that there's going to be a lot of traveling in the future, made more complicated by this pandemic. But I think statewide coalitions we in California can't think only about California. We have to think about people who may be coming to us or other so-called haven states to take care of people who will not be able to get care in their own states.
Yeah, thank you for this question, Tina. I think that fighting at a state level is really where it's at. As we will be talking about later, it's no secret probably to anyone watching this that Roe v. Wade is under extreme threat. However, many states, primarily in the South, are already essentially living in a post-Roe world. And those states have really created the blueprint for how we are going to activate our communities, how we're going to organize in our communities. Right now, I live in Massachusetts, but I was born and raised in the South, and I got my organizing chops there. And so this is really personal to me as well as a professional issue. And so, for example, here at Daily Kos, we worked with our partners in Virginia to help pass the RHPA, that's the Reproductive Health Protection Act, which is finally comprehensive abortion legislation in Virginia that is proactive and protects access. And this has been needed for so long. And it's because of the long-term strategic organizing on a state level that that enabled this major win in a purple state to happen. And as we really question the future of Roe and the future of abortion access, we know that the fight is going to turn to the states. And so I would really encourage everyone watching and everyone learning about this to understand and to really get involved with knowing that nationwide, yes, of course, abortion access is threatened and we have to take national action, but getting involved in your state is going to be really crucial to be able to help your communities navigate a potential lack of access.
Yeah, thank you so much for that, Sarah. And I wanted to jump in and just say a little bit about what we are doing at TFUN on a state level. We are a part of a coalition called the Trust, Respect, Access Coalition. And it's a coalition made up of organizations trying to fight abortion restrictions because our Texas state legislature introduced over 33 bad abortion bills last year. And so we work on proactive bills, but also develop strategy to fight those bills. On another statewide level, you mentioned, Tina, the sanctuary cities. We have those in Texas, sanctuary cities for the unborn. When it began last year in June, the first city in Texas was Wascom, and they named Texas Equal Access Fund, along with other abortion funds and some abortion clinics, as criminal organizations unable to work in those towns, along with the ordinance that they passed. And so we coupled with the Lilith Fund and the ACLU and filed a suit against 7 of those cities that named us. And they all changed their ordinance to take our names out. So that feels like a win to me, and I'm very excited about that. Something else that we do at the local level is that we have something called Repro Power Dallas. There are some Repro Power Texas things that happen all over, but we work on the Repro Power Dallas, and we're really trying to work with local county commissioners and city councils to pass proactive abortion legislation at the local level.
And can I just on that last point, which I think is incredibly important, because you know, I live in a state that's, you know, it's a purple state. I'm in Pennsylvania, but we're not going to get any good legislation passed at the state level. But in cities, you can really do a lot. And in the past year, we've seen some great examples of New York and Austin both passing bills to fund from city funds the abortion funds, the local abortion funds. And that can happen at the local level. We saw St. Louis, Missouri, which is probably in one of the most hostile abortion states in the country. St. Louis passed a provision that provides for high quality prenatal and postpartum care for women incarcerated in jails. So it's not an abortion, but it's reproductive justice, right? And so this is important activism that can happen at a local level, even when your state may seem hopeless, local level. And, you know, the anti-abortion movement has been excellent at this for a long time. And I feel like the pro-choice, reproductive rights side of things has really kicked up their game in the past 5 years, thinking at the local and state level.
I just want to add one more thing to this part of the convo, is that I think that what COVID has really highlighted for us is that local action is critical. When everything shuts down, we can't expect to be saved from the outside. That community building and collective power within our communities is what's going to get us through. And so this is extremely important for people to be thinking about, is how you are going to build strength locally.
Yes, thank you so much, Dr. Moyetti. That is a fantastic note to end that question on. And so, Camion, I would love to talk to you a little bit more about abortion funds. So this is also really personal to me. I am a fellow abortion funder, and prior to moving to Massachusetts, I served on the board of the Carolina Abortion Fund and really fell in love with funding abortion. And so we know that abortion funds are central to the conversation around state level fights for abortion access. You explained a little bit earlier, how abortion funds work, how the T Fund works, what you all do. But I'm wondering if you can also talk to us about the really specific ways that abortion funds have to think outside of the box in order to help people access the abortion care they need. Because abortion funds really are sometimes outside of the mainstream reproductive health and rights movements. And I think that can be a really powerful tool. And so I would love to hear some of the unique ways that you all help folks access care.
Thank you for that. And feel free to add anything from your experience at Abortion Fund if you want. But I would say that abortion funds are mutual aid. Like the fact that someone even thought up, let's fundraise so that people can access the care because they can't otherwise and it's so necessary, is already like outside the box. And then after that happened, realizing there are these other barriers. People can't get where they need to go. They have children. There's all of these things, right? So I think even just the work of abortion funds is creative and unique, but I serve on the board for the National Network of Abortion Funds. And so I know that there are over 70 abortion funds across the country, which I think people are shocked to hear that number. And 8 of them are in the state of Texas. There are direct links to clinics and patients. People running abortion funds have a unique expertise also because they are often from the very communities that they're serving, and they know that the barriers within that community. In Texas, we have some funds that work specifically around the border, and they provide a completely different service, and their clients face different barriers than our abortion fund might face in the Dallas-Fort Worth area. Abortion funds also work really closely together. So I don't think that this is as well done in other nonprofit sectors, but abortion funds collaborate on fundraising. We collaborate on getting clients the care that they need. We work closely together as abortion funds to ensure care and often assist the same people, especially if we all provide different services. During this pandemic, abortion funds, especially in Texas, had to increase this collaborative work and the collaborative funding. Abortion funds are all about collective power. I saw sometimes 3 to 10 abortion funds assisting one person in getting care. But the fact that we know how to reach out to someone else to get this resource to ensure that someone gets care is amazing to me. I can remember we get random calls. So this is a little bit personal, but I used to be a volunteer with the T Fund. I started in 2006 and then joined their board in 2013. And one of the calls that I took as a volunteer has stuck with me around a question that we always ask is it safe for you to talk right now? And this person said no. And then I asked basically can I call you back later? And they were like, no, I need to talk to you now. And I figured out they were in a car, someone could hear. So we did the entire intake process with me asking yes or no questions and them telling me their gestation or how much money they needed by talking about an address or something else to give me the numbers, and just realizing that we do what we can to ensure people get the care that they need. Other creative ways abortion funds do this work is by talking about abortion, saying it as many times as possible, and doing that in a way that pushes towards reproductive justice. I say we try to do that in beautiful ways. Check out Abortion Fund social media. Look at our swag. I'm wearing a shirt from NNAF right now that says everyone loves someone that has an abortion. I think even just doing that is huge, because I've had so many conversations with people about abortion just because of this shirt, right? And abortion funds also get involved. They get involved in like almost every social justice movement that there is, because we do things from a reproductive justice lens, which means we have to eradicate barriers around healthcare, immigration, homophobia, transphobia. We have to, disability access, like we have to eradicate all of these barriers to help the people that we're calling, and that are calling us. So I just wanted to uplift that, like, you can see abortion funds and look to abortion funds as leaders that provide a support to our callers facing these barriers. And we do this because we are bold and courageous at abortion funds, and also because it's necessary and people need it.
Thank you for that. Given everyone on the panel and how much brilliance there is here, I feel like it would be a really missed opportunity not to talk about June Medical Services. I'm realizing, though, that I've brought it up a few times and we've not broken down what it is. David, I'm looking at you if you feel comfortable to kind of break down what it is, how it can threaten Roe, and then I'd like to throw it to everyone. I feel like a lot of people are preparing for something to happen during a pandemic, and they're scrambling and they're scared. So tell us, David, what it is, and then if everybody wants to kind of jump in and talk to us about what you're preparing for personally.
So it's a Supreme Court case that was argued before the Supreme Court in early March. It's out of Louisiana, where there are currently 3 clinics. And what the state of Louisiana said was that every abortion provider in the state has to have what's called admitting privileges, which is a contractual relationship between the provider and a hospital, a local hospital. Now, in 2016, the Supreme Court said that almost exactly the same law out of Texas was unconstitutional, because the result of this admitting privileges law is that it shuts down clinics and it doesn't give any benefit to the patient. There's no benefit to having this contractual relationship. It's really a money relationship. It's not about safety. It's about a money relationship between the provider and the hospital. And what winds up happening is, in a state like Texas and Louisiana, you have Catholic hospitals that refuse to contract with an abortion provider, or you have hospitals just run by conservative people or risk-averse people who don't want to be the focus of attention by contracting with an abortion provider. So they get this sort of third-party veto to shut down clinics. And in Louisiana, if this were to go into effect, we'd go from 3 clinics to sort of like half a clinic. You would have 1 remaining clinic, and that clinic would only have 1 provider who would only be able to provide a portion of the abortions at that clinic. So it would have a devastating effect on the state of Louisiana, which is a really large state. I mean, it's next to Texas, so it seems small when you look at it on a map, but it's really actually a quite large state. So with 1 clinic, it would be almost insurmountable barriers for patients to get care. So the Supreme Court heard the case in March, and this is a very important case because it's the first case that is being heard with the 2 new Trump justices on the Supreme Court, Neil Gorsuch and Brett Kavanaugh. And so it's a big question what they are going to do, how this new Supreme Court is going to treat abortion. I went into oral argument of the case really scared what was going to happen, and I'm still scared, but I'm a little less scared than I was after oral argument, because the 2 justices who this is going to really come down to are Chief Justice Roberts and Brett Kavanaugh. And they did not seem like they wanted to use this case to upset the entire landscape of abortion law. That could happen several years from now, like overturning Roe v. Wade, or overturning Planned Parenthood versus Casey, or even overturning the 2016 case out of Texas. It didn't seem like that's what they were interested in doing. What they were interested in this case, it seemed, an oral argument is never a perfect predictor of what's going to happen, but it seemed that they were really interested in the facts on the ground in Louisiana. What exactly will the burden be in Louisiana? What exactly will the benefit be? So I am scared for Louisiana. A bad decision in this case would be really devastating to the people and the providers in that state. But as I think going into this case, when we heard the Supreme Court was going to take this case, we were really scared for what they could do beyond this issue, beyond admitting privileges. And I don't think they're going to do it this time. Now, that doesn't mean next year they're not going to take a different case and do that. It also doesn't mean I'm just going to completely predict wrong. Everyone predicts the Supreme Court wrong, so maybe they will. But we'll find out. So just to finish this off, we normally hear from the Supreme Court by the end of June. So about a month from now, we should know what happens in this case. So all eyes will be on this.
The other thing I'll just, oh, sorry.
Go ahead.
I was just going to add about the admitting privileges piece, that it might not even be that the hospital is conservative or that or anything like that. Admitting privileges are an internal system for a hospital to make sure that their physicians practicing there are credentialed and competent. But as an abortion provider, if I just look at my work in abortion care, I rarely ever admit a patient to the hospital. And so there is a case volume that you have to keep up to maintain your privileges at a hospital, because the hospital needs to ensure that you're competent to continue practicing there. But if I'm only providing abortion care, I will never generate the number of emergencies or admissions required. However, the other things that I do as an OBGYN, like birth care, that is where I might generate those cases. But if I'm only doing abortion care, I will never take that volume. And ultimately, that's the hospital's prerogative. It's not to make sure that abortion providers can continue providing in the community, although I think it should be.
If I can just add to that, first, just on what Dr. Moyadi said, I remember a few years ago when the admitting privileges issue came to the fore, the woman who's the director of the one clinic in North Dakota said, I never have a doctor who causes 10 admissions a year, which is what the standard was in her community. And she said, if they did, that doctor would never work here. I would never hire him or her. So it's just, it's a catch-22. But just going back to Tina's question, the pandemic and the Supreme Court case, I mean, in some ways they're connected, but in other ways they're not. I mean, even if we get the best possible outcome from the June v. Russo case, I'm still pretty worried about the pandemic. The abortion providers are doing heroic things. They are going to work in clinics all over this country, putting themselves at risk, putting the staff at risk. Patients are very bravely going. There's all kinds of good innovations happening. As one clinic director said, our parking lot is now our new waiting room. In other words, keep the patients as much as possible away from other staff, other patients, have as little personal contact as is possible. But that still doesn't get us around the problem of traveling. And that's really something that the best creative minds are going to have to figure out. If you have your own car and you don't have to stay over, and in many states, as David told us earlier, there's waiting periods, sometimes 24 hours, sometimes 48 hours, sometimes 72 hours. You're going to have to find a place to stay. As Camion told us earlier, you're going to have to figure out how to eat. This is really what I am worried about, how patients who need to travel are going to be able to travel.
This is Camion. I just wanted to jump in and say to Tina's question, how we're preparing for what might possibly happen in Louisiana is knowing that we'll probably have to collaborate more with some practical support funds to get those people to our area. So we have a number of our clients, callers, who already get care in Louisiana. If you live in East Texas, the Louisiana clinic is like 96 miles or less to get to. Whereas if you live there and you're trying to go to the Dallas-Fort Worth area, which would be the next closest clinic, it's hours and hours, right? So we know that that will probably mean additional traveling barriers for our clients that are living in East Texas. So we're also concerned and looking at this ruling because, like I said, it doesn't just affect one state. It's not just going to affect Louisiana. Like, it's going to affect a lot of places. And it's going to affect our fund.
Great. So yeah, we here at Daily Kos are also preparing for whatever decision that might come down. And something that we are really honing in on, especially in the past year or so, is focusing on state fights. You know, we've repeatedly said over the past hour that state fights are crucial, and that is going to continue to be the case. And so something that I'm really looking at, along with a number of partners on the ground in various states, is how to react to whatever the ruling is with some kind of action. And so, for example, in Massachusetts, where I live, we are part of the Roe Coalition here in the state. And so there is a bill in the state legislature called the Roe Act that is proactive legislation that would help guarantee abortion access if Roe were overturned. And so whatever the decision of June v. Russo, we're hoping to use it to really galvanize support for the Roe Act and hoping to push various proactive measures like that really around the country. And so thinking about how any potential ruling can be turned into action as well. And so on that note, talking about legal matters, the landscape around abortion access is obviously becoming increasingly complicated in regards to legality, especially in the face of COVID-19. There's a lot of information that is very confusing about whether abortion is essential or non-essential healthcare. There are a number of lawsuits that have been filed. There are ongoing cases. And so, Carol and David, what are your recommendations for people who are trying to make sense of this tangled web of how to access abortion during the pandemic? And where should they turn to find really trusted information?
One, call your local abortion fund. I think by now, having heard Camian for the last hour, she's a trustworthy source. I mean, your local abortion funds will know. I also would recommend people call the National Abortion Federation hotline. I mean, they keep track of things nationally. They are very sympathetic people who will tell people the best place to go. They'll find out where you live and where you might go and so on and so forth. So abortion funds, National Abortion Federation hotline. And you easily found online.
Yeah, and then there's a great website called ineedana.com, which I need an abortion, but ineedana.com, which is an excellent place to find a close abortion clinic. What you don't want to do, or at least what you want to be real cautious in doing, is just Googling abortion clinics near me, because mentioned it earlier a little bit in passing, but there are fake clinics all over the country, and they far outnumber actual abortion clinics. And Google does a terrible job of differentiating them. And so you need to be very skeptical when you just Google, and be careful, because the fake clinics' websites will look like they do abortions. And then people will go to those clinics, and what they will find is non-medical professionals who are passing themselves off as medical professionals, claiming to give good medical advice, and they are lying. They are instilling fear in people. They're telling them false information about their gestational age, either too early, so take your time to make a decision, and then you'll run past the actual limit in your state, or you're too late, so you can't even make a decision because you're past the limit and you actually have time. These practices and a lot of others are just rampant in these fake clinics, and if you just go to Google, you have the risk of finding those. So you need to go to trusted sources: abortion funds, the National Abortion Federation, Abortion Care Network, Planned Parenthood, ineedana.com. These are some of your trusted sources.
And I just wanted to jump in and say that if you need to find your local abortion clinic, you can go to the National Network of Abortion Funds website, abortionfunds.org.
Thank you. So switching gears a little bit, there's been some preliminary research that self-managed abortion is on the rise with COVID-19. We know that it's safe, but we also know that it's criminalized. And so I'm going to open this up to everyone. If there are folks watching right now who are considering self-managing, what is important for them to know legally or otherwise?
So I think there's a few important things to know. There are many legal gray areas around self-managed abortion. There's If When How is an organization that has legal support for people who are self-managing abortions, and they have a lot of excellent information on their website. There is, I believe it's called Plan C, which is also a website about self-managed abortion and in the United States, and getting having pills, information about having pills mailed to you is not necessarily legal. So there's ways around that. But it's certainly, as abortion is becoming more difficult to access in clinics, self-managed abortion is on the rise. It is very safe. That is one of the important things to know when you get the actual medicines. Any complication that comes from taking the medicine is indistinguishable from complications related to miscarriage. So people who go to an emergency room or a medical care professional that they don't want to tell that they were taking an abortion pill, they don't have to, because your medical professional won't be able to know that that's what you took. It will just seem like you're miscarrying. But there are circumstances in which people have been punished legally around the country around self-managed abortion, often linked to race and race discrimination and racial oppression. And so there is some care and risk that has to be taken with self-managed abortion in the current legal, especially if you are in some of the more conservative parts of the country. But it is being done. It can be done both safely and without legal risk. But you need to investigate and take care.
Could I add to that? I just want to clarify something. We're equating here self-managed abortion and the use of two medications, mifepristone and misoprostol. I mean, those two medications together are what are referred to as medication abortion, which now is about 40% of all abortions in the U.S. Are done this way. In fact, the whole COVID thing is making medication abortion all the more important because it doesn't involve as much contact as other forms of abortion. But there are other kinds of self-managed abortion that are not as safe. So I think it's really important to put that out there. We hear horrible stories of people trying herbs that not only often don't work, but can cause serious problems, even death in some cases that have been documented. Horrible cases, not often come up in the news about women desperately asking boyfriends, or excuse me, in one case, even a stranger, to hit them on the stomach. Excuse me. So anyway, I'm sorry about this. And this cough, by the way, is not COVID. I'm just coughing, but I'm healthy, knock on wood. Anyway, so when we talk about self-managed abortion in this conversation, we are talking about medication abortion. And another form of it, and the Texans will be more knowledgeable than me, is even using one of these drugs alone, misoprostol, also is highly effective. Not quite as effective as the two drugs, but also effective. And misoprostol is, in some respects, easier to get than both drugs.
All right. If folks don't have anything else to add on that question, we're going to move on to our final question. We're a little bit over time, but I know some folks are sticking with us, so really appreciate that. And so to wrap everything up, I want to turn our attention back to the South. And as the pandemic unfolds, and as June versus Russo threatens abortion access nationwide, it seems extremely wise to rely on leadership of folks in the South, where we see some of the most restrictive abortion laws. In this moment, Camion and Dr. Moyetti, what lessons do you hope that folks will take from the South?
Everything. Camion, do you want to start with that?
Yeah, lessons from the South. I think, everything. I mean, I like to remind people that like Texas has been at the forefront of the abortion access and legal rights battle since the beginning. Like we've had Roe versus Wade, we had Hellerstedt, we have had these bans, and to look to us, but to see that like we don't give up, right? Like we keep fighting those restrictions tooth and nail, and we're dedicated. And also like visualize, I think that other folks need to also like think about the restrictions that we face in the South around healthcare in general.
Yes.
Like there are overall barriers to healthcare in our state. And so like just seeing how resilient and fierce people are.
Yeah, I think I just echo that Texas has really been on the forefront of restrictions, but also I'm just incredibly inspired by the work that we do here in Texas too. We've also been on the forefront of innovation and advocacy. Groups like all of our abortion funds, like T Fund, like Lilith Fund, like West Fund, like Frontera Fund, like CASN, like I really hope I'm not forgetting someone and not uplifting all our amazing funds.
Bridge Collective,
Fund
Texas Choice, West Fund, Frontera Fund.
So just so many amazing abortion funds, but then groups like Afia Center, groups like Jane's Due Process, just doing incredible amounts of activism and advocacy. We have an incredible physician base here in Texas that work here, that advocate here, that raise our families here. And we are all a huge community of activists. And I feel like a lot of us were doing this work before HB2, but HB2, like that galvanized us as a movement, I feel like. And so look to us in how you build community strength and resiliency, and how we are just continually innovating new ways to protect our communities. And, last thing I'll say is that really that, protecting Roe isn't enough. Like what Camion was saying, the community that I'm a part of and take care of, they're not just struggling with access to abortion. They're struggling with feeding their children. They're struggling with paying for childcare. They're struggling with having jobs right now. They're struggling with paid sick leave. They're struggling with deportation. And so all of these issues are important, and it's not enough to protect Roe, that we have to be standing for all of these things if we really want to be advocating for for our shared values.
Yeah, that was the last thing I was going to say too, Gosela, is look to the South and Abortion Fund specifically to make your movements and your works more intersectional, because we can't win any of these battles alone, and all the intersections are where we got to get it.
What a perfect sentiment to end our panel on. So I know that I can speak for Tina as well when we want to thank our fantastic panel, Carol, David, Camion, and Dr. Moyetti. Thank you so much for being here. We really, really appreciate your expertise and your willingness to show up here and the ways that you serve all of your communities. And so with that, we will sign off, and thank you all so much for tuning in.
Thank you.
Thanks, everyone.
Thank you so much.